The scope of the financial crisis at the Oklahoma State Department of Health is becoming clear. For years, the state agency used a series of accounting tricks to produce bogus balanced budgets, while at the same time, the agency was teetering on the edge of financial collapse.
In the auditorium at the Cleveland County Health Department, State Finance Director Preston Dorflinger stood in front of a group of local health department workers, explaining what he has found so far at the State Health Department after taking over as Interim Commissioner of Health.
I've spent this past week assessing that financial situation and have identified over expenditures beyond the agency's annual revenue from approximately 2011 to the current fiscal year.
The sheer scope of the wrongdoing was an eye-opener for Dorflinger, who says it is now very clear that more oversight is needed of state agencies.
There is a need for a different level of visibility into agencies that receive federal funds, and that is another conversation we'll be having with the legislature regarding statute changes.
Dorflinger is asking the legislature to come up with $30 million so he can make payroll this month, something that threw a big monkey wrench into the state's already unbalanced budget.
And it's a complicating factor. There's no question that this couldn't have come at a worse time. We cannot allow this agency to fail.
Senate President Pro Tem Senator Mike Schultz seemed to indicate they'll come up with the money.
We want to be cognizant to meet their funding needs or what they need, not give them too much because we certainly have other needs, but we also don't want to short them.
And the governor has issued an executive order creating a joint commission on public health to examine every aspect of the state's health department's operation.
To look at Oklahoma's public health system and identify ways to make it more lean, efficient, and effective.
In the past, that phrase, more efficient and more effective, has meant cuts.
Not necessarily cuts. It could be things such as not filling vacant positions. It could be such thing as combining positions, just finding efficiencies in operations.
The governor named Gary Cox as chairman of the Joint Committee. He is executive director of the Oklahoma City County Health Department. He sees a clear mission for the special panel.
Give them some insight from folks that have a lot of experience in public health in Oklahoma on how to improve things and make them better.
The state's 77 county health departments run separate of the state health department, but some of the critical funding does come from the state agency. Without that $30 million, Cox says it would mean cuts.
It would mean cutbacks in services. And for Oklahoma County in particular, the primary money that we get from the state health department would be in the area of Children's First and FEMR, which is Fetal Infant Mortality Review.
Both programs are aimed at improving the health and survivability of infants and children, which have already proven to be very effective. Cox is a nationally recognized expert on public health services. His agency expects to provide services to more than 80,000 people over the next year. While the state health department had a budget in excess of $400 million with more than 2,000 employees, the Oklahoma City County Health Department does its work with 220 employees and a budget of $27 million a year.
And so we look at that data to find out where are the health challenges, where are the gaps in service, where might we reprioritize our efforts and our resources to have a bigger impact on improving health.
The Joint Committee is expected to issue a report on how to transform the state health agency into an operation that can actually have an impact on improving the health of Oklahomans. The state currently ranks 46th in the nation. The governor has added to the legislature's special session a call for funding of $30 million for the state health agency. While lawmakers decide if they'll approve that amount, work will continue at the state health department because that price tag could grow. Much of the appropriated money came from the federal government, an amount that may have to be paid back.
As we interact with our federal partners, that will come to be known. We'll do everything we can to mitigate that as part of our action plan. But yes, it is a possibility.
Dorflinger says the state will also demand a new level of transparency throughout the state health department.